Early signs of a heart attack. These are critical to recognize, and understanding them could save your life or the life of someone you love. Before we dive into this crucial information, please take a moment to subscribe to our channel. Our
Could you
goal is to reach
please?
100 subscribers, and your support means a lot to us. Now, let's get started. A heart attack, also known as a myocardial infarction, occurs when the flow of oxygen-rich blood to a section of the heart muscle is blocked. This blockage is often caused by a buildup of fat, cholesterol, and other substances, which form a plaque in the coronary arteries. When the plaque ruptures, it can create a blood clot that obstructs blood flow. Without the oxygen it needs, the heart muscle can become damaged or die. Heart attacks are extremely serious and can be fatal if not treated immediately. According to the World Health Organization, heart disease is the leading cause of death globally, accounting for 17.9 million deaths each year. In the United States alone, someone has a heart attack every 40 seconds. That means, by the time this video ends, numerous lives will be affected by this silent killer. Recognizing the warning signs can make the difference between life and death. The sooner you recognize the symptoms and seek medical help, the better your chances of survival and recovery. This isn't just about numbers, it's about real people's lives. Your life, the lives of your loved ones, and the lives of millions around the world. 1. Chest pain or discomfort. Let's dive right into it. The first and most common symptom of a heart attack is chest pain or discomfort. Now, I'm not talking about a slight twinge or a mild ache. This kind of pain often feels like intense pressure, squeezing, fullness, or severe pain in the center of your chest. Imagine someone placing a heavy weight on your chest and leaving it there for minutes. It can be terrifying, and it's a major red flag. This pain might last more than a few minutes or go away and then come back. Some people describe it as a feeling of tightness or like an elephant is sitting on their chest. It's not something to ignore or brush off as simple indigestion or stress. It can happen while you're at rest or doing something physical. This pain or discomfort can radiate to other parts of the body, making it even more confusing and distressing. Pay attention to your body and don't hesitate to seek medical attention if you experience this symptom. 2. Discomfort in other areas of the upper body. Next, we have discomfort in other areas of the upper body. A heart attack doesn't always limit itself to your chest. Pain or discomfort can spread to your arms, particularly the left one, but also to your back, neck, jaw, or stomach. Picture this. You're feeling fine, then suddenly you have this strange, uncomfortable sensation radiating from your chest to your arm or jaw. It's confusing and alarming. This isn't just any muscle pain. It could be your heart crying out for help. The discomfort might start in your chest and move outward, or it might start in another part of your upper body and be mistaken for something else, like a pulled muscle or a dental issue. This pain can come on suddenly or gradually increase in intensity. Don't ignore these signs, thinking they are unrelated to your heart. Any unusual pain or discomfort in these areas should be taken seriously. 3. Shortness of breath. Shortness of breath is another critical symptom. This might come with or without chest discomfort. Imagine doing something as simple as walking to the mailbox, and you suddenly find yourself struggling to breathe, gasping for air. It feels like you've just run a marathon when you've only taken a few steps. This could be a sign that your heart isn't getting the oxygen it needs. Shortness of breath can happen whether you're resting or being active. Sometimes this symptom can be accompanied by chest discomfort, but it can also occur on its own. It's a scary feeling, like you can't get enough air into your lungs, and it can come out of nowhere. You might also notice that you're feeling unusually tired or winded after activities that wouldn't normally wear you out. This is your body's way of signaling that something is seriously wrong and needs immediate attention. 4. Cold sweats. Now let's talk about cold sweats. This isn't your usual sweat from exercise or a hot day. Picture yourself suddenly breaking out in a cold sweat, like someone has thrown a bucket of ice water over you. It's clammy and uncomfortable, often accompanied by a feeling of anxiety or dread. This sudden, inexplicable sweating can be a warning sign of an impending heart attack. Cold sweats can occur at any time, whether you're resting or engaging in physical activity. It's your body's response to stress, pain, or a lack of oxygen. The sweat can be so intense that it soaks through your clothes, and it's not related to the temperature or your level of exertion. This symptom can make you feel weak and shaky, adding to the overall feeling of unease. If you experience this kind of sweating without a clear reason, it's a signal that something is very wrong and needs to be addressed immediately. 5. Nausea or lightheadedness. Nausea or lightheadedness is another symptom to watch out for. You might feel sick to your stomach or dizzy out of the blue. It's as if you've spun around in circles and now the room won't stop spinning. This isn't just an upset stomach from bad food. It's your body's way of signaling that something is seriously wrong with your heart. Symptoms can be particularly misleading because they can easily be mistaken for something less serious, like the flu or a stomach bug. You might feel like you're about to faint or actually pass out. The nausea can be so severe that you might even vomit. This kind of dizziness and nausea isn't something to take lightly, especially if it's combined with any other symptoms of a heart attack. It's your body's alarm system telling you to seek medical help immediately. 6. Fatigue. Fatigue is a more subtle, but equally important symptom. Feeling unusually tired or weak, sometimes for days or even weeks before a heart attack, is something to take seriously. Imagine feeling exhausted after doing simple activities that normally wouldn't tire you out. This persistent, unexplained fatigue could be a sign that your heart is struggling. You might find it difficult to perform everyday tasks that you usually do without any trouble, like climbing stairs, carrying groceries, or even walking short distances. This kind of fatigue is different from the usual tiredness you feel after a long day or a lack of sleep. It's overwhelming and persistent, making it hard to get through your day. If you notice that you're feeling unusually fatigued for no apparent reason, it's time to pay attention to your body's warning signals. Preventive measures. Preventing a heart attack starts with understanding and managing your risk factors. Here are some key preventive measures you can take. 1. Healthy diet. Eat a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit saturated fats, trans fats, cholesterol, salt, and added sugars. 2. Regular exercise. Aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous activity per week. Physical activity helps keep your heart strong and reduces the risk of heart disease. 3. Maintain a healthy weight. Being overweight or obese increases your risk of heart disease. Maintain a healthy weight through diet and exercise. 4. Quit smoking. Smoking is a major risk factor for heart disease. If you smoke, quit as soon as possible. Avoid secondhand smoke. 5. Manage stress. Chronic stress can contribute to heart disease. Practice stress management techniques such as deep breathing, meditation, yoga, or hobbies that relax you. 6. Monitor blood pressure and cholesterol. High blood pressure and high cholesterol can damage your arteries and increase the risk of a heart attack. Have regular checkups and follow your doctor's recommendations for managing these conditions. 7. Limit alcohol. Excessive alcohol consumption can raise blood pressure and increase the risk of heart disease. If you drink alcohol, do so in moderation. By adopting these lifestyle changes, you can significantly reduce your risk of experiencing a heart attack. Emergency response tips. If you or someone else experiences symptoms of a heart attack, it's crucial to act quickly. Here's what you should do. 1. Call emergency services. Dial your local emergency number, e.g. 911, immediately. Time is critical during a heart attack, and emergency responders can provide life-saving treatment on the way to the hospital. 2. Chew aspirin. If you have been prescribed aspirin by your doctor and it's readily available, chew it slowly to help reduce blood clot formation. 3. Stay calm and rest. If you're the one experiencing symptoms, try to stay calm and sit or lie down. Avoid exertion, which can strain your heart even more. 4. Perform CPR if trained. If the person becomes unconscious and stops breathing, and you are trained in cardiopulmonary resuscitation CPR, begin chest compressions and rescue breaths until help arrives. 5. Use an AED if available. If an automated external defibrillator, AED, is nearby and someone is trained to use it, follow the device's instructions to administer a shock if necessary. Remember, quick action can make a life-saving difference for someone experiencing a heart attack. Don't delay seeking help. Disclaimer: this video is for informational purposes only and not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Now that we've covered the critical signs and symptoms of a heart attack, it's important to remember that awareness and early action are key to saving lives. If you found this information valuable, please consider subscribing to our channel. Our goal is to reach 100 subscribers, and your support helps us continue to educate and empower others about essential health topics. To recap, recognizing the early signs of a heart attack, such as chest pain or discomfort, discomfort in other areas of the upper body, shortness of breath, cold sweats, nausea or lightheadedness, and unusual fatigue, is crucial. Taking preventive measures like maintaining a healthy diet, regular exercise, managing stress, and monitoring blood pressure and cholesterol levels can significantly reduce your risk. In an emergency, knowing how to respond quickly by calling emergency services, chewing aspirin if advised, and staying calm can make a life-saving difference. Stay vigilant, stay informed, and most importantly, stay healthy. Thank you for watching, and we look forward to seeing you next time.